Question 1. A patient's prescription is for cephalexin 500 mg capsules. The pharmacy only stocks 250 mg capsules. The prescription is for dispense number 20. How many 250 mg capsules should be dispensed? A. 10 capsules. B. 20 capsules. C. 30 capsules. D. 40 capsules. Answer: D. 40 capsules. This question tests your ability to perform dose conversions based on available stock strength. The keyword dispense and the quantities provided tell you a calculation is needed to match the prescribed dose to the available product. The prescription requires 500 mg per dose, but the pharmacy has 250 mg capsules. This means you need two 250 mg capsules to equal one 500 mg dose. Since the prescription is for a total of 20 doses, capsules, you must dispense twice that amount in the lower strength, so 20 doses * 2 capsules / dose equals 40 capsules. Always double-check that the total milligram amount dispensed matches what the prescriber ordered. Question 2. Which of the following drug classifications is commonly used to treat hypertension? A. Antidepressants. B. Antilipidemics. C. Antihypertensives. D. Antibiotics. Answer: C. Antihypertensives. This question asks about drug classifications used for high blood pressure. The term hypertension is a medical term for high blood pressure, and the keyword classification points to the type of drug. Antihypertensives are specifically designed to lower blood pressure. Antidepressants treat mood disorders, antilipidemics treat high cholesterol, and antibiotics treat bacterial infections, none of which directly treat hypertension. Knowing drug classes helps you understand what conditions medications are used for. Question 3. According to federal law, what is the maximum number of refills allowed on a prescription for a Schedule IV controlled substance? A. 0. B. 1. C. 5. D. 11. Answer: C. 5. This question is about federal regulations for controlled substances, specifically focusing on refills for Schedule IV drugs. The keyword federal law indicates you need to recall the standard legal limits, and Schedule IV specifies the category of controlled substance. Federal law permits up to 5 refills within 6 months of the date the prescription was written for Schedule III and Schedule IV controlled substances. Schedule II substances have no refills permitted. Remembering the refill limits for different controlled substance schedules is crucial for legal dispensing. Question 4. A unit dose package contains: A. Multiple doses of a medication in one container. B. A single dose of a medication ready for administration to a particular patient. C. Bulk medication to be measured out by the pharmacy technician. D. Medication intended for over-the-counter sale only. Answer: B. A single dose of a medication ready for administration to a particular patient. This question defines a common dosage form used in institutional pharmacy settings. The term unit dose is the key phrase, implying a specific quantity. A unit dose package contains one dose of a medication prepared for immediate use by a patient, often labeled with the patient's name, room number, and administration time. This system helps reduce medication errors and improves efficiency compared to measuring doses from bulk stock each time. Think of it as a pre-portioned meal for the patient's medication needs. Question 5. Calculate the body mass index, BMI, for a patient who is 5 feet 10 inches tall and weighs 185 pounds. Use the formula, $BMI equals \frac, weight \in \pounds, height \in inches, ⁻2, \times $703. A. Approximately 23.6. B. Approximately 25.1. C. Approximately 26.6. D. Approximately 28.1. Answer: C. Approximately 26.6. This question requires a specific mathematical calculation using a provided formula for body mass index. The keywords are calculate the body mass index and the patient's height and weight, along with the explicit formula to use. First, convert the height entirely to inches. 5 feet * 12 inches per foot equals 60 inches, plus the additional 10 inches equals 70 inches total. Then plug the values into the formula. $BMI equals \frac 185 \pounds 70 \inches \2 times $703. This calculates to $BMI equals \frac 185 4,900 times $703, which is approximately 0.037755 times 703, resulting in roughly 26.54. Always ensure your units match the formula provided and double-check your calculations. Question 6. Which of the following is a common brand name for the generic drug atorvastatin? A. Zocor. B. Lipitor. C. Crestor. D. Mevacor. Answer: B. Lipitor. This question tests your knowledge of common brand and generic drug names, specifically focusing on atorvastatin. You need to associate the generic name with its widely recognized brand name. Atorvastatin is a statin medication used to lower cholesterol, and Lipitor is its well-known brand name. Zocor is simvastatin, Crestor is rosuvastatin, and Mevacor is levastatin. These are different statin drugs. Memorizing the brand and generic names for commonly prescribed medications is essential for accurate dispensing. Question 7. A prescription reads, take 1 tablet PO/BID. How often should the patient take the medication? A. Once daily. B. Twice daily. C. 3 times daily. D. 4 times daily. Answer: B. Twice daily. This question tests your understanding of common prescription abbreviations. The key abbreviations are PO and BID. PO stands for per os, meaning by mouth, and BID stands for bis in die, which means twice a day. Therefore, take 1 tablet PO/BID translates to taking 1 tablet by mouth twice daily. Knowing common Latin abbreviations is vital for correctly interpreting prescription instructions. Question 8. What is the primary purpose of a drug formulary in a healthcare setting? A. To list all available drugs in the world. B. To provide a list of approved medications that are covered by a specific insurance plan or institution. C. To detail the chemical structure of every drug. D. To track the dispensing history of individual patients. Answer: B. To provide a list of approved medications that are covered by a specific insurance plan or institution. This question defines the function of a drug formulary. The keyword formulary refers to a specific list of drugs. A drug formulary is a list of medications selected by an insurance plan or healthcare institution that are preferred and covered. Its primary purpose is to manage costs and promote the use of clinically effective medications. It is not a list of all drugs globally or a place to track patient history or chemical structures. Formularies influence which medications are readily available and affordable to patients. Question 9. A prescription is written for vancomycin 1 gram for every 12 hours. The pharmacy has vancomycin vials containing 500 milligrams powder. How many vials are needed per dose? A. 0.5 vials. B. 1 vial. C. 2 vials. D. For vials. Answer C. 2 vials. This question requires you to calculate the number of vials needed based on the prescribed dose and the strength of the available vials. The key information is the dose 1 gram and the vial strength 500 milligrams. To solve this, first ensure both quantities are in the same units. 1 gram is equal to 1000 milligrams. Then, divide the required dose, 1000 milligrams, by the amount per vial, 500 milligrams, to find out how many vials are needed per dose. 1000 milligrams/500 milligrams per vial equals 2 vials. Pay close attention to units like grams and milligrams in dosage calculations. Question 10. Which law established the Food and Drug Administration, FDA? A. Pure Food and Drug Act of 1906. B. Federal Food, Drug, and Cosmetic Act of 1938. C. Durham-Humphrey Amendment of 1951. D. Kefauver-Harris Amendment of 1962. Answer B. Federal Food, Drug, and Cosmetic Act of 1938. This question tests your knowledge of significant U.S. pharmacy law history. The key element is identifying the law that created the FDA. The Federal Food, Drug, and Cosmetic, FD&C, Act of 1938 was a landmark law that required new drugs to be proven safe before marketing and established the FDA to oversee this process. The Pure Food and Drug Act of 1906 was earlier legislation, while the Durham-Humphrey Amendment defined prescription drugs, and the Kefauver-Harris Amendment required proof of drug efficacy. Understanding these foundational laws helps contextualize modern pharmacy practice. Question 11. A medication order is for D5W at 125 milliliters per hour. How many liters of D5W are needed for a 24-hour period? A. 1.25 liters. B. 2.5 liters. C. 3.0 liters. D. 3.5 liters. Answer C. 3.0 liters. This question requires a calculation involving flow rate over time. The keywords are the flow rate 125 milliliters per hour and the duration 24-hour period, and you need the total volume in liters. First, calculate the total volume in milliliters over 24 hours. 125 milliliters per hour * 24 hours equals 3000 milliliters. Then, convert milliliters to liters, knowing that 1 liter equals 1000 milliliters. 3000 milliliters / 1000 milliliters per liter equals 3.0 liters. Ensure you perform the necessary unit conversions to arrive at the correct answer. Question 12. Which of the following is a high-alert medication that requires special care to prevent errors? A. Amoxicillin. B. Lisinopril. C. Insulin. D. Ibuprofen. Answer C. Insulin. This question asks to identify a high-alert medication from the list. High-alert medications are drugs that bear a heightened risk of causing significant patient harm when they are used in error. The keyword is high-alert medication. Insulin is a classic example of a high-alert medication because errors in dosage or administration can lead to severe hypoglycemia or hyperglycemia, which can be life-threatening. Amoxicillin, lisinopril, and ibuprofen, while common medications, are not typically classified with the same level of risk as insulin in terms of potential harm from errors. Always exercise extreme caution and follow strict protocols when handling high-alert medications. Question 13. What is the primary role of the Pharmacy and Therapeutics (P&T) Committee in a hospital? A. To manage pharmacy technician schedules. B. To decide which medications will be included in the hospital's formulary and develop medication use policies. C. To process patient insurance claims. D. To negotiate drug prices with manufacturers. Answer B. To decide which medications will be included in the hospital's formulary and develop medication use policies. This question asks about the function of the Pharmacy and Therapeutics (P&T) Committee. The keywords are Pharmacy and Therapeutics, P&T, Committee, and Primary Role. This committee, typically composed of pharmacists, physicians, and other healthcare professionals, reviews and evaluates medications for inclusion in the hospital formulary based on efficacy, safety, and cost. They also develop guidelines and policies for safe and effective medication use within the institution. While they consider cost, their main role is clinical decision-making regarding which drugs are available and how they are used. Question 14. How many grams of a 10% ointment are needed to make 60 grams of a 2.5% ointment? A. 5 grams. B. 10 grams. C. 15 grams. D. 20 grams. Answer C. 15 grams. This question involves a pharmacy calculation related to compounding dilutions using the alligation method or a proportional calculation. The key information is the desired final quantity, 60 grams, the desired final concentration, 2.5%, and the available concentrated ingredient, 10% ointment. You need to find the amount of the 10% ointment needed. Using the formula C1V1 equals C2V2, concentration 1 asterisk volume 1 equals concentration 2 asterisk volume 2, where V here represents grams, we have $10% times X grams equals 2.5% times 60 grams $. Solving for X, $X equals frac, 2.5 times 60, 10, equals frac, 150, 10, equals $15 grams. Therefore, 15 grams of the 10% ointment are needed. Remember that the total amount of active ingredient in the final mixture is the sum of the active ingredients from the components. Question 15. According to USP General Chapter less than 797, what is the maximum beyond use date, BUD, for a low-risk compounded sterile preparation stored at room temperature? A. 24 hours. B. 48 hours. C. 7 days. D. 14 days. Answer B. 48 hours. This question tests your knowledge of sterile compounding standards set by USP less than 797. The keywords are USP General Chapter less than 797, low-risk compounded sterile preparation, and room temperature, asking for the maximum beyond use date, BUD. USP less than 797 provides guidelines for BUDs based on risk levels and storage conditions to ensure sterility and stability. For a low-risk preparation stored at controlled room temperature, the maximum BUD is 48 hours. Understanding USP less than 797 BUDs is critical for patient safety in sterile compounding. Question 16. What is the generic name for the brand name drug Nexium? A. Omeprazole. B. Pantoprazole. C. Esomeprazole. D. Lansoprazole. Answer C. Esomeprazole. This question requires you to identify the generic name corresponding to a common brand name medication. The brand name is Nexium. Nexium is a proton pump inhibitor, PPI, used to reduce stomach acid. Its generic name is esomeprazole. Omeprazole is Prilosec, pantoprazole is Protonix, and lansoprazole is Prevacid. These are different PPIs. Accurately linking brand and generic names is fundamental to preventing medication errors. Question 17. Which of the following tasks is not typically performed by a certified pharmacy technician? A. Preparing for admixtures. B. Counseling a patient on medication use. C. Performing dosage calculations. D. Receiving written prescriptions from patients. Answer: B. Counseling a patient on medication use. This question asks you to identify a task that is outside the typical scope of practice for a pharmacy technician. The keyword is not typically performed by a certified pharmacy technician. Patient counseling regarding medication use, including side effects, storage, and proper administration, is a responsibility reserved for the pharmacist. Pharmacy technicians are authorized to perform tasks like preparing IVs, performing calculations, and receiving prescriptions under the supervision of a pharmacist, but patient counseling requires the pharmacist's clinical judgment and legal authority. Question 18. A patient needs 500 milliliters of a 0.9% sodium chloride solution. How many grams of sodium chloride are needed to prepare this solution? A. 0.45 grams. B. 4.5 grams. C. 9 grams. D. 45 grams. Answer: B. 4.5 grams. This question is a pharmacy calculation involving the preparation of a solution based on percentage strength. The key information is the volume of the solution needed, 500 milliliters, and the desired concentration, 0.9% sodium chloride. Percentage solutions are typically expressed as grams of solute per 100 milliliters of solution. So, a 0.9% solution contains 0.9 grams of sodium chloride per 100 milliliters. To find out how many grams are needed for 500 milliliters, you can set up a proportion, $frac, 0.9 grams, 100 ml, equals frac, x grams, 500 ml, $. Solving for x, $x equals frac, 0.9 times 500, 100 equals frac, 450, 100 equals $4.50 grams. Understanding how to interpret percentage strength in solutions is vital for compounding. Question 19. What is the purpose of MedWatch? A. To report adverse events related to medical products. B. To track controlled substance prescriptions. C. To provide drug pricing information. D. To manage pharmacy inventory. Answer: A. To report adverse events related to medical products. This question asks about the function of a specific FDA program. The keyword is MedWatch. MedWatch is the Food and Drug Administration's, FDA, program for reporting serious problems suspected to be associated with the use of FDA-regulated medical products, including drugs, medical devices, and dietary supplements. It allows healthcare professionals and consumers to voluntarily report adverse events and product problems. It is not used for tracking controlled substances, drug pricing, or inventory management. Reporting adverse events helps the FDA monitor the safety of products on the market. Question 20. Which of the following drug classes is most likely to cause a dry cough as a side effect? A. Beta blockers. B. ACE inhibitors. C. Calcium channel blockers. D. Diuretics. Answer: B. ACE inhibitors. This question tests your knowledge of common drug side effects associated with specific drug classes. The key is identifying the drug class known for causing a dry cough. Angiotensin-converting enzyme, ACE, inhibitors, such as lisinopril or enalapril, are a class of medications commonly used for hypertension and heart failure. A persistent dry cough is a well-known and relatively common side effect of this class of drugs. Other antihypertensive classes listed do not typically cause this specific side effect. Recognizing common side effects helps in counseling patients and identifying potential drug-related problems. Question 21. A prescription for ciprofloxacin ophthalmic drops reads GTTS2OS bid X 7 days. How should this be interpreted? A. Instill 2 drops in the right eye twice daily for 7 days. B. Instill 2 drops in the left eye twice daily for 7 days. C. Instill 2 drops in both eyes twice daily for 7 days. D. Instill 2 drops in the left ear twice daily for 7 days. Answer: B. Instill 2 drops in the left eye twice daily for 7 days. This question requires you to interpret common prescription abbreviations, particularly those used for ophthalmic, eye, and otic, ear, medications. The key abbreviations are GTTS, 2, OS, BID, and X 7 days. GTTS means drops, 2 means 2, OS is the abbreviation for oculus sinister, meaning left eye, BID means twice daily, and X 7 days means for 7 days. Therefore, the instruction is to instill 2 drops in the left eye twice daily for 7 days. Pay close attention to the abbreviations for right eye, OD, left eye, OS, and both eyes, OU, to avoid errors. Question 22. A patient's insurance requires a prior authorization for a prescribed medication. What does this mean? A. The medication is not covered by the insurance plan. B. The pharmacy needs to order the medication from a special supplier. C. The prescriber must obtain approval from the insurance company before the medication will be covered. D. The patient must pay the full cash price for the medication. Answer: C. The prescriber must obtain approval from the insurance company before the medication will be covered. This question defines the insurance term prior authorization. The keyword prior authorization indicates a specific requirement from the insurance provider. A prior authorization means that the prescriber must contact the patient's insurance company and provide justification for the need for the medication before the insurance will approve coverage and payment for the drug. This process is often used for expensive medications, those with potential for misuse, or when less expensive alternatives are available. It's a step required by the insurer, not just the pharmacy or the patient, to ensure coverage. Question 23. What is the volume, in milliliters, of a solution containing 500 milligrams of a drug if the concentration is 25 milligrams per milliliter? A. 10 milliliters. B. 15 milliliters. C. 20 milliliters. D. 25 milliliters. Answer: C. 20 milliliters. This question requires a calculation to find the volume of a solution given the total amount of drug and the concentration. The key information is the total amount of drug, 500 milligrams, and the concentration, 25 milligrams per milliliter. To find the volume, divide the total amount of drug by the concentration. Volume equals total drug amount / concentration. So, volume equals 500 milligrams / 25 milligrams per milliliter equals 20 milliliters. Ensuring your units are consistent, mg and mg/ml, is crucial for accurate calculations. Question 24. Which type of drug recall is issued when a drug product is unlikely to cause adverse health consequences? A. Class 1 recall. B. Class 2 recall. C. Class 3 recall. D. Voluntary withdrawal. Answer: C. Class 3 recall. This question tests your knowledge of the different classes of drug recalls issued by the FDA. The keyword is unlikely to cause adverse health consequences, describing the severity of the potential harm. A Class 3 recall is for situations where the use of or exposure to a violative product is not likely to cause adverse health consequences. Class 1 recalls are for situations where there is a reasonable probability that the use of or exposure to a violative product will cause serious adverse health consequences or death. Class 2 recalls are for situations where use of or exposure to a violative product may cause temporary or medically reversible adverse health consequences or where the probability of serious adverse health consequences is remote. Knowing the recall classifications helps you understand the urgency and potential risk associated with a recalled product. Question 25. According to the Poison Prevention Packaging Act, PPPA, which of the following medications is not exempt from child-resistant packaging requirements? A. Sublingual nitroglycerin. B. Oral contraceptives in memory aid dispensers. C. Prednisone tablets. D. Anhydrous cholestyramine. Answer: C. Prednisone tablets. This question asks about exemptions under the Poison Prevention Packaging Act, PPPA, which mandates child-resistant packaging for certain hazardous household substances, including many medications. The keyword is not exempt, meaning you need to identify the medication that does require child-resistant packaging. While there are several exemptions under the PPPA, including sublingual nitroglycerin, oral contraceptives in specific dispensers, and anhydrous cholestyramine, among others, oral prednisone tablets are not generally exempt and typically require child-resistant packaging unless specifically exempted by formulation or requested otherwise by the patient or prescriber. Familiarizing yourself with the common PPPA exemptions is important for compliance.